just gonna say, where's our card? But I see it there.
All right, so I've started the webinar. I'm going to go ahead and do the Facebook piece.
Okay.
Nicole, maybe we start.
Right.
Do you mind if I hook a small lavalier microphone up to you?
Okay. Oh yes, most definitely. Where can this? I need to set it aside. Can I just leave it
This is
someplace?
fun right here,
Okay. That and here's our team. That's Rich,
Oh.
Kimmy.
Hold up, I'm getting back to it. Hi, Rich. How are you?
Okay.
Is that Tamika?
Yes.
Hi,
Yes.
Tamika.
Hi.
Nice to meet you here. I look like
Nice-
this.
Nice to meet
Okay,
you
wait,
too.
wait.
Sorry I couldn't be
Yes,
there.
okay. Hold on. I'm turning
Oh,
the camera back around
Okay,
so you can see him.
okay.
Can you go ahead and transfer that call?
Hi,
There.
I'm sorry
There
I
you go.
couldn't be there. How are you?
Well, I'm doing well. We're sorry. We're sorry you couldn't be here either. We missed you.
Yes, I'm missing everything, all the good stuff. I would love
Yeah,
to
but
be in there.
your girls are in good hands.
Oh, I know it. I know it. I know it. I can't wait to see this procedure live too. So this is going to be awesome.
Wonderful.
Yes,
Wonderful.
great.
Wonderful. Well, I'll make sure that I'm going to load them up with Bauman swag, and I'll make sure that they bring home extra for you to make.
Please, please, because they got it. They got to then pour it into me. So yeah.
Yeah, yeah.
You have a
Absolutely.
great day.
All
Nice
right,
to meet
too.
you.
All right,
Pleasure.
nice meeting you as well.
Okay, Kimmy, this is
Hi,
Mark, right?
Michael.
Michael, hi Michael.
Yes,
I
and
can't
this
see
is how
Michael.
I really look.
Wait. This is how
Oh, and this is how I really look. I hide all the meanness in here.
You hide it all behind the mask. It's all behind the mask.
Exactly.
He's the video production guy.
I love your background. I mean, you could do a little show out of that background right there. All the placements very nice.
Thank you.
Look at
I
the
chose a good
cabinets. I
one.
love the cabinets.
Thank you.
Who's your designer, girl? Give me his number.
Too funny.
Google Images.
It's very nice meeting you.
Nice.
I'll give you guys some great footage.
Thank you. Nice meeting you as well.
Thank you.
Yeah.
Pleasure.
It's gonna be great. It's gonna be great. So this is like the powwow room, and then surgical rooms. These are all procedure rooms.
Okay.
And Dana's getting ready. She's getting her blood drawn and all that good stuff.
Okay.
Yeah. And then this is another room over here,
Another procedure room.
like
Wow.
where stuff happens.
Yes, the magic.
Yes, magic happens.
Nice.
Mhm.
Nice.
Yeah.
What's
So,
that machine over there under the TV?
this is one of the smart graph machines.
That's for doing the transplants. Okay.
Yes. Yeah.
Nice.
Yep. So.
Very nice. I like it. I like it.
This looks like it's a camera too that kind of helps with.
Yeah.
Yeah.
I see the shampoo bowl in there.
Yeah. They have a couple of these all around. I really like that.
I
Here
think
we go.
we are live on Facebook now. We should have a live.
Okay.
So I want to welcome everybody to the show. It's a special show today. We have it live at Bauman Medical in Florida. So we have our very own Dana Wilson. She'll be getting a procedure today that you and I, all of us, get to view. So we are there with her, supporting her.
Say hi, Dave.
Hi, Dana.
Hey, Kimmy.
Hey.
Hey, everybody.
Yes.
Okay. So she's getting her blood drawn so that they can be able to put it in the centrifuge so that they can spin it down and that's what they're going to use to do her PRP.
Awesome.
It's busy in here.
Yeah. Beautiful facility.
Yes, very nice. We saw a lizard outside.
Oh, there are plenty lizards in Florida.
Plenty. They're not
Plenty.
even scared. I don't like them.
No. They're used to people now. They don't even
I'm
run
scared.
probably.
They're not scared.
How's the weather there?
It's very nice. It's very nice.
Nice and warm, I'm sure.
So Dana's getting mic'd up, and we're gonna have some really, really good footage because Michael's gonna be assisting us too. So
Okay.
Do you have a place for it?
yeah, it's gonna be cool.
This is good.
Yeah. So hope you guys are tuning in.
I
If
hope
not,
so.
you can catch the replay, and it's gonna be great.
Yeah, I'm monitoring it right now. So we do have someone on
Okay.
watching.
Hey, thanks for joining us.
Yeah. So we're just getting started, guys. So we still have a few minutes while they get Dana
What
prepared
we
for the
know now.
procedure.
What we know now.
Mm-hmm.
So you guys have time to start your watch parties, tell a friend. What's going on today is we're going to have a live viewing of one of our own hosts, Dana Wilson. She will be getting the PRP done, platelet-rich plasma. So you'll get to see this live. You'll actually know firsthand, get a full visual of what actually occurs doing this procedure. So go ahead, start a watch party, tell a friend.
Whatever. Make it good. Yes. And also, this is what I call the right way. Sorry, I'm biased.
Is
Don't be
this
offended. It's the way that I learned, and it's been really effective. And so I just think this is how it should be done.
Yes.
Dana's trying to start a watch party.
That's right. Start your watch parties. Dana, do yours.
I'm trying.
You watch, people watching, share it.
Oh, share with video. Yeah.
Tell a friend, phone a friend.
You can even join in on the Zoom if you like.
Yeah.
So that way you can ask questions in real time.
Yep. Let me go ahead and give the
And we
Zoom
can answer.
information out. I will put the Zoom link in the description, so just give me a second. Or if you go to Zoom, you can type in the meeting ID, which is 815-4471-1057. Again, that is 815-4471-1057. One more time, 815-4471-1057. The ID, the participant ID or the passcode is going to be 903536. The passcode is 903536. Again, passcode is 903536.
Well, I guess I better start mine. What am I doing?
I'm going to go ahead and put the link in Facebook. Get there without disrupting anything.
No. I'm sorry, you guys. I'm trying to do too much. It's okay. They're going to draw her blood now to do it. And once again.
Okay, the link is now in the comment section. So if you want to go ahead and click the link, you can join in live in real time because there's a slight delay on Facebook. Get in on real time and be an attendee on the Zoom or in our Zoom room, as we like to call it. Don't worry, we cannot see you, but you'll be able to see everything live. So if you're worried about being
That's
seen,
right.
you won't be seen.
See, they can't see my face, right?
How you doing, Dana?
I'm good. I'm
All
good,
right.
everybody. My veins is trying to be shy right now. Can you step off on me? Okay. Good job. I couldn't dare be squeamish with my little boy always getting his blood drawn. I couldn't dare be squeamish. Is that great?
Let's see if I can do it.
Now Dana is the star of the hour, but we're waiting on the other star of the hour, which is Dr. B. And he'll be here shortly.
Lori, they take about 50 cc's of the blood.
Go ahead.
Just sharing to the audience.
Uh-huh.
They take a nice amount.
Okay, did you guys hear that? They take about 50 cc's of blood.
Okay.
And Dr. B has a sweet spot number that he likes to work with as far as platelets. And what's that number again?
Anywhere between 1.1 and 1.3 million
Okay.
per microliter.
Did you hear that, Kimmy?
No.
1.1 to 1.3 million platelets per microliter.
Okay.
Dr. B likes to work with.
It's a large number. That's good. If you guys have any questions, I mean, we are with the professionals or with the staff now. I mean, go ahead and put your questions in the comments. We can ask them.
Yes, they can whistle while they work and talk and chew gum and everything while
Yes,
they work.
exactly. If this is something you were thinking about doing for yourself and you have questions, put them in the comments.
You can't do this watch party.
Yes. So now they're gonna prep the blood and put it in the centrifuge so that they can get it together. This is so awesome.
And it'll be better if you get into the Zoom room and you're able to ask your questions in there, because like I said, there's a slight delay in Facebook. So in Zoom, you're in real time with us. So if you can get on the Zoom, click the link. Don't worry, we cannot see you. You can remain anonymous and you can ask your questions.
Don't be shy. We're not even gonna
Don't be
show you
shy.
on camera.
So look at that. So the blood is being transferred?
Yes. So it can get spent down, right?
Yes, we're transferring it so we can spin it.
Yes.
Okay.
We do a double spin.
A double spin. Okay. Wow, looks like a lot of blood.
It does.
Okay.
We got a little drawer for you there.
Okay.
And so, mind you, this is not for you to try to do at home. We're just showing you for educational purposes.
I want to get my hair washed.
She's going to get her hair washed. Okay, you want to go see?
Okay. All right, so we definitely
She's
have
going
to
to get her
cleanse the
scalp
scalp.
prepped.
Yeah.
A laser. Oh, I'm getting laser.
You get laser.
Oh, laser. Okay. Oh, laser first before the procedure.
And this is to help stimulate the blood flow so that we can have everything cooking for us up here first.
So you guys stimulate the
You're breaking up, at least on my end. I don't know.
Right now, laser. Right. Is to stimulate the blood flow so that we can have good blood flow when we everything stimulated.
Uh-oh. Looks like I dropped out. They lost their
connection.
mhm.
So we gotta get it back to dinner.
All right, we've lost them, but I'm trying to get them back on. Just give us 1 second. Oh, she's getting platelet rich plasma done. It's to help to grow hair. So she's in Florida right now. Give me 1 second. Let me just try to get a hold of them and let them know that they dropped. Okay. All right. So they'll be coming back in. Up here, she's coming back in now. Lori, I can see you. I can hear you. Is it allowing you to turn your camera on? Do I need to send you? Here, let me send you a request. Okay, I sent you a request. Oh, lost her again. Sorry, you guys, we are having technical difficulties, but we will get everything back up. It might be the room that they're in. So. Let her know. Okay. So just bear with us. They'll be coming back in. They'll be coming back in. I don't know if any of you guys have tried to get onto the Zoom. If you have, please let me know and let me know if you're having difficulties. Please hang in there with us. We're just having a little technical difficulties. We are working to get them back onto the Zoom so that you can see what's going on currently. Dana is under the laser right now, which is to help to stimulate more blood flow to the area as well. So they went to another room. So as they got to that room, I noticed that the signal seemed to have gotten kind of bad. So it's probably because that they are in that room. So if you just hang in with us, we will be able to bring them back in shortly. We are working on it. So just hang tight with us. Okay. So for those that are just joining, we are doing a live of Dana, our host, one of our hosts, who is getting a procedure done called platelet-rich plasma. Platelet-rich plasma is to help to stimulate hair growth. And so she decided to share with all of us that procedure. So you'll get to see it done live here. So they did draw 50 cc's of her blood, which they would then take and transfer it into another container so that they can add it to a centrifuge to spin it down to separate the blood and get the platelets from it. And so they did that portion already. And so they went to take Dana to another area or room where she was going to do laser therapy. So as they got to that room, that's when we started having some technical difficulties. The laser therapy is to stimulate blood flow to the area. So the laser is actually going to be done on her scalp. So she should be sitting under a piece of equipment. It has a hood to it. There's some red lights that you'll see, which are the lasers. And so she'll be sitting under that. We didn't get to hear for how long, but as soon as they get back on, I will ask to find out how long she's to sit under there. But that is to just bring some more blood flow to the area. So we're trying to get them back on. If you guys be patient, stick with us. We want to continue to show this. And so we'll be getting them back on as soon as possible. You guys, this is our, oh, we have an attendee. Let's see, Lori. Hey, Lori, can you hear? I'm going to move you. I just realized you were in there.
A lot of people read them. So
Okay,
I'm going to move you to panelists. Just
Yeah.
give me a sec.
can you hear me?
Yep, I can hear you.
a lot of those same ones, but I've
No, I can't
strengthened
get it
the
on.
ads
Okay.
that go in them.
Get in.
More compelling.
Okay.
What else we have a data.
You should be moving to panelists, Lori. Looks like it's taking some time, but okay. All right, Lori, you can unmute yourself, and I'm going to ask to turn on your video. You're on as a panelist now.
There's a lot of that we had. Dr. Gordy, to ever do virtual.
You're back. Welcome back.
Like 18 years ago. Now they're.
I can't see though.
See me?
No, it's black. So how long does Dana have to stay under the laser device?
She's still on.
I'm still
Can't
on.
see any of you.
No, I can't see anything. I just see it's dark, like something's covering the camera. I don't know.
No, and I can't see you either.
You can't see me? Well, we're still on live. Oh, something just, there you go. But you're muted now, but I can see Dana under the machine, under the laser device.
There was only a handful of
Okay,
people
can you
who
hear
were
me?
here.
Yes, I can hear you
They were
now.
still open, so we would see like an emergency
Yeah. Okay.
patient that
Mhm.
came in with
So,
like scalp
Um,
inflammation, or they had an infection or something like
okay,
that.
we're back.
But other than that, so Dr. Bauman was here. There was at least 1 or 2 surgical techs here for in case we need to
Okay.
see a patient.
Yes, lots
Our
of
nurse
technical
practitioner directed finance,
difficulties,
everybody
but
else worked from home.
it's okay.
Amazing.
So during those 6 weeks,
she's
when I
still
was
up
working
under
from
the
home, I was probably
laser.
busier in those 6 weeks than I was.
So
normally.
maybe she's sitting up
Just
under
because
there
we
for
had
like
pivoted to a
20,
bunch of things different.
25 minutes.
We developed new products.
Okay.
We introduced, for example.
Yeah, I was
the
telling the
virtual PRP
audience
kit,
that
so
she's
that
under
people
there
weren't
to help
coming in
stimulate
to,
more blood flow. Is there anything else you wanted to add to that?
We had an alternative.
No, they just, and so it kind of gives them time to spin down the blood and get
Okay.
everything together. So
Packages, I mean, there were a lot of things that we did.
that's what's happening
We still had to
first.
pivot,
Yeah.
but we were prepared better than most,
So-
that's for sure.
So,
that's
yeah.
what it sounds like.
All right.
Laura, did you guys introduce Rich?
Hold on, everybody. We're going to introduce you to Rich, and he is the marketing
Rich.
I'm
director.
the director of marketing for Bauman.
Mhm.
We hope you find this very, very enlightening and educational. Dr. Bauman doing PRP, I learn something new every single time I watch him do it. For those of you that are interested in PRP or may have had it in the past, not all PRP is the same. Dr. Bauman will explain, what makes his protocol different. And most importantly, why it lasts a lot longer. Many practices that do PRP for scalp treatments would recommend redoing it every 3 to 6 months. So you're doing it 3 or 4 times a year. Ours lasts Dr. Bauman's lasts on the average between 10 and 18 months. So we recommend doing it annually. So that's a really, really big difference. And why that's the case, Dr. Bauman will explain when he goes through it, I'm sure. So stay tuned. This should be very, very educational. And I think you guys are taking questions from your followers, right?
Yes.
Okay.
Yeah.
So Dr. Bauman will try his best to answer all of your questions as we go along.
Okay, great.
So thanks for joining us.
Stay tuned.
Thank
even
you.
If, even if we pop off and stuff, that's okay. It's it's technology, it's Wi-Fi. So sometimes it doesn't work. But we're trying to make it happen. So stay tuned. D Will, how long do you have to stay up under there? And we actually did a Scalp Detox on Dana last night. I performed it on her, so her hair is fresh, hair and scalp freshly clean. Like clean. Okay, and we will get some pictures beforehand so that you can see what it looks like before, and then we'll just track the journey afterwards.
Yeah.
So it's gonna be great.
This is good stuff.
Like we said, anybody thinking about doing PRP, like we literally got on the plane this morning, flew down here, and we'll be back home by midnight tonight. So, I mean, sometimes you got to do what you got to do when you want the best.
Absolutely. You got to travel for it. Sometimes you do have to travel for it.
Yeah. So.
This is the hair hospital.
And Dr. B is our guy. So.
Absolutely.
Yeah. The facility is amazing.
This is an amazing facility.
Oh, hey, take a look at this, guys. So right now, like I said, we're in a kind of a waiting room, right? And waiting room is not like they don't feed you or nothing here. Look, this is all at your access. Okay. It's great. It's awesome.
Nice. Yeah.
Okay. And then, hey, check out, because Dr. Bauman had a new laser cap.
I see it. I see it up there.
That's his own. And here is the model of it. It's on. It's awesome.
What's cool about it is that it captures the hairline.
Yeah, it captures the hairline. So
yeah,
You know, if you look at most caps and things that's out there, they don't seem to cover all areas, but this one does.
Yep.
And it
Even-
also can be laid flat into your back for travel. That's what I think is pretty cool about it.
Yeah.
Yeah.
Yeah,
It's
it
awesome.
collapses. It does.
Yeah,
Mhm.
collapse.
And so, like any doctor's office, you have your befores and afters playing. Dr. B does really good work. Eyebrow transplants, eyelash transplants.
Yeah, that's amazing.
Mhm.
He does, you know.
Look at these before and afters. Look at that. It's a great big difference. Actually, the man looks younger.
Yeah.
You know, it took some years off of him.
Hair matters.
It does.
Yeah, it matters to your self-esteem.
hmm It's how we present ourselves to the world. So,
So if you're experiencing any type of hair loss, thinning, don't wait. I mean, it's not normal. Of course, you're not going to die with the same amount of strands that you had when you were born, but being bald and having, you know, big gaps with no hair, you don't have to be like that. I know people say it's hereditary and all those different things, but it's okay. You still can get it. You still can get it to come back if you want to. But you just need to act. Don't wait. You just need to act fast. Time equals hair follicles. So
yeah.
the longer that you wait, the harder it is to try to recover. So you want to try to do something about it fast. And does everything require a medical procedure or medication to reverse? No, it doesn't. But you have to do something. So just don't wait. So yeah. It's so exciting.
I know it is. So I encourage everyone to take control. Take control of what is going on with your hair. You don't have to settle for
Y'all need
having
to see
hair
me with
loss.
my mask off high.
Oh, I see your whole face. Hey, Lori.
That is killing me. I'm so tired of being in this mask.
But every night you can just peep out, get your little fresh air, and go back.
Man, I've been peeping all morning.
You really? I know, because you had the fly in wearing that and the whole airport experience. Yeah.
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 It really wasn't that bad though. The airport wasn't really that bad today.
It wasn't crowded either. Was there a lot of people flying?
No, it wasn't crowded. I mean,
got
they
the
had a long
TSA
line
good.
because you have a long line because of the 6 feet distance, but it really wasn't crowded.
Okay.
Yeah.
Yeah. Yeah, it was cool. We've been moving around pretty good.
Yeah.
This is so exciting. Just to think, when did we have Dr. B on our show?
He was on what? About
Was that September? I think it was
3
September.
or 4
I
months
think
ago.
so. Yeah.
Yeah.
September.
Yeah, and I
think it
threw
was.
out that idea of me coming down here and doing that live,
And it's happening. Look, we
Yep.
make stuff happen. We really
Yes,
do.
we do.
We make it
And then we
happen.
share it with you guys.
I know,
So,
right?
sharing is definitely caring. I mean, she's letting you in on a procedure that normally people, you know, they don't even really even tell a spouse or shoot a loved one that they're going to get something like this done. And she's sharing it with the world. So
Right.
this is to help you guys to, hey, okay, something's going on with my hair. I need to do something. This right here is motivation. This will take the fear out of it too, because you actually get to see firsthand what is going on.
Right.
Mhm.
Oh, okay. Okay, we're gonna go out.
Okay.
Hold on. So I'll take you on a little a tour, lightweight tour.
Is that the front desk that you just passed?
This area is like the procedure where the surgeries take place on
Okay.
this floor.
Mm-hmm.
And this is just one section of it. So on the other end Salon B is over there on that end, and administrative offices.
Get my
So-
scalp washed now.
Okay, now she's gonna go get her scalp wash. Let's go.
Okay.
In the washing machine?
Oh, I heard about that.
Sometimes with females, it works a little different because sometimes it makes
So their hair is long. You wanna take
sometimes.
the earrings out, Zero? Now this machine, this machine is a little special. In the way that it's designed to clean the scalp beforehand. But it kind of works different for people with longer hair, is that right?
Well, it's just that sometimes it makes the hair a little bit dry when we're doing this scalp
Mm.
wash.
Okay.
I mean, we normally can probably do it if
Mhm.
you like it. Keep yourself up for 1 second. No, you don't have to sit there, just keep yourself up. And bring it back. And then look. And I might have to have you scoot up just a tad. Oh, here.
See, Lori? Okay.
Okay.
I know, I'm sorry.
All right.
I'm such a bad camera person. I
You
apologize.
doing good? No, you doing good now. Don't. Now I can
Look,
see.
I'm trying to see too. Isn't this fun?
It is.
Say how it feels and all that. Tell what you experienced.
So first, let me just say, it's so nice to be serviced.
Oh
I'm
yeah.
so used to being on the other end. So so at first it feels good to be serviced. The water is warm, so that's nice. And everything just feels nice and comfortable right now.
Now that's a special solution for cleansing, right?
Right. This is the HIPAA cleanse. HIPAA cleanse is to help kind of keep the area nice, clean, sterile.
Okay. It feels nice and foamy. Is it foamy? Because it feels nice and foamy.
As it comes out.
Yeah.
Mhm.
It just feels nice and cool.
Felipe trains with the monks for his hair. For the fingers.
Right.
His professional hand massage.
Oh yeah, this is good. It's so nice to get service, I tell you.
He's getting a double whammy.
Yes,
I know it is.
this is good stuff.
Here at Bauman Medical, we like to service our people by giving them scalp washes. And not only scalp washes, but we remedy with a massage.
So my scalp is I already had got my scalp clean last night, so we're getting another scalp clean. So my scalp is gonna be very nice and clean for this procedure.
Mhm.
So I'd like to ask a question for anyone else that's been out there and has had PRP done. Did they do this to you before being serviced? Like, was this part of the process?
Yeah.
I told you I'm kind of biased, so.
This feels great.
Yeah, I'm curious. I want to know. Did they get shampooed or cleansed before the process, the procedure? I want to know too.
Because this process is to sterilize the scalp beforehand, so
Yeah.
I think it's an important step.
I think so too. I mean, just think about when we go and we draw blood, like, they do wipe down the area with alcohol swabs. So, I mean, yeah, I'm curious to know.
Yeah. So tell us, people, tell us.
Please let us know.
Yeah. So just so you guys can get a look at the machine really good. Like say normally it's well, sometimes it's a little different depending on the person's hair that they have. It's like a
No, I
washing.
wanted to see it closed and
It's
do
a
it
wash.
quick.
It's like a washing machine. It's so neat to see it in action. But
Well, while you're under this, so there's a bar that goes around it. So that also would come
Oh,
on and spray water.
he said he will turn it on so you can see.
Okay, great.
So give us a second while he gets D-Will
Okay.
once he gets her breaked up, she's gonna turn it on.
Okay, great. Hey, Dana.
No, this is so exciting.
I'm jealous. I want to do it too.
Hey.
I'm gonna ask Dr. B, is it sometimes like Botox? Well, I know it's not, but if you have a little bit left over,
Yeah, he gets up too.
could they share it with me?
Thanks for your question. PRP is platelet-rich plasma. So PRP is platelet-rich plasma.
And
Yes.
you notice that you focus on the scalp when he cleaned the scalp. He
Yes.
doesn't focus
Yes.
on the hair.
Did you hear that, guys? Like he was focusing on the scalp, getting the scalp
Yeah.
sterilized versus like the hair is not the focus. The
Right.
scalp is.
Okay.
I'm gonna look for the cap to this.
Okay.
You can actually run it, but I just need the actual close.
Okay. Okay. He's gonna get a piece and then he's gonna show us what the machine closed to run that for us.
All right.
Does your scalp feel any different?
My scalp feels very clean.
Look.
Between last night and today, my scalp feels
Yeah.
like fresh and clean.
Yeah.
Oh, yeah.
Yeah. She gonna have to get some Malaysia fur to put back in the scalp.
But you know what I thought was interesting? I didn't expect to be under the laser prior. So that was an interesting step there, that you're gonna get that blood circulation first. Then we came in here and get my scalp all clean prior to the procedure.
Yeah. So as we're doing all these steps, I want you guys, like I said, if you've had the procedure done before, did you experience any of these steps as you were getting, or did you just walk in the office, they draped you up and went to sticking? Let us know.
Did you get the capture of them spilling that blood in there? Okay.
No, we had some technical difficulties, but we did see it get transferred. Yeah.
Okay.
We popped out and well, we just saw her. It looked like a lot of blood.
Yeah, 50 cc's
That's a nice
is
amount.
It
more
looked
than
like a
I.
lot of blood.
Yeah, it did. It looked like a lot. So
Like I was like, yeah, that because the little thing was this wide around, and they filled it up. You need a cracker?
No, I'm fine.
like donating blood, right?
Yeah.
Right.
You feeling all right?
You know, that's what they do. They give you, they used to do that. I don't know if they still do. They used to give you a cracker afterwards. Only did it one time. So.
Oh man.
So unfortunately, actually, it's down for now.
Oh, okay. The machine is down for now, so we won't get to see that today.
Yeah, so
Next
Okay.
time.
there's
Okay.
a point that they're trying to get. But it does wake you up in the morning.
Oh my gosh.
What's that?
When I was here for my hair coach training and saw it in action, it was like, oh my gosh, that's so neat. I want to do it. I want to get my hair washed in there.
I mean, it looks fantastic. Like
It's like really you don't he did it by hand, but really the machine is going to do everything. Like, you know how you got a shower,
Yeah.
it got where it comes out, and just because you can kind of see these spigots here, and over here, so the water is shooting out, and you got this bar here that's going to be going around.
it's like a spa with jets. I
Yes,
mean,
and so there is no hand touching the person. The machine is going to do all the work.
Wow.
Yeah.
We are, this technology is unreal right now. Okay.
Yeah.
you are with the best. You are.
So cool.
Yeah. And so there are other people here getting procedures done today, like hair transplant.
Or the FUE.
Or
right?
the FUE, yeah. So they're getting some other people scheduled, and they can usually do 3 to 4 procedures at one time. they have the capacity to do that.
Mhm.
So yeah, much
So
fun.
we're just waiting in the queue.
Yeah, we're in the queue.
We're in the queue.
Dr. B is busy.
Yeah.
Yes.
He hopping and popping.
For those of you who are just joining us and catching us now on this live, one of our hosts, Dana Wilson, is getting a procedure done today called platelet-rich plasma. She is in Boca, Florida, at Dr. Bauman's facility, Bauman Medical,
So
and
you're
she's sharing this with you. Yeah, there we go. Bauman. And so she is sharing this with us and you guys to show you that you can take control of what is going on with your hair. You don't have to settle for dealing with hair loss. There's definitely treatments for your hair loss. And so the earlier that you act on it, the better the outcome is for you. And this should take some of the fear out of getting help too.
Yeah.
So
Yeah. And
Hey.
How are ya?
Hey, how are
here he is.
Fantastic.
The man
there's
of
the
the hour.
doctor.
What's going on? Great to see
So
you. Laura.
excited to be here.
Nice to see you. My team taking me
You let your hair
serious.
grow.
I did let it
Yeah,
grow.
Yeah, you let it grow.
Let it grow way out.
A busy man today, huh?
Yeah, usual, it was a typical day.
That's
Yeah.
good.
Typical day.
Busy is awesome.
BMG.
Okay.
So our next step is to map out and to photograph the areas that we're going to be treating. So
Okay.
we're going to get you inside the photo room in just a few moments.
Okay.
All right.
Perfect.
The team got your blood already?
Yes.
Great, fantastic. Well, once we have the photos completed, then we'll get you back inside
Okay.
and we'll get the local anesthetic underway.
Okay.
All right?
All right.
Awesome.
Thank you.
See you in a few minutes.
All right.
Yes.
So now I have a scalp photo shoot.
Yes. Yes. Yes.
I'm gonna take pictures of my scalp to see where we actually need to inject the PRP.
Yeah, it's gonna be awesome.
This is just amazing to be to be original. A hair
Yeah.
hospital, who does that? But really, just obviously COVID is a pandemic, but hair loss is an epidemic. We see it every day. People are losing their hair for one reason or another. And for some, we think that oh, my mom lost her hair. It's in my family. There's nothing I can do about it. Some people just slap a wig on and keep going. Some people do comb over and keep going. But really, you can do something about it if you start on it early.
Yes.
Like any changes you might see, any slight changes you might see. Ready to go? Okay.
Ready for your photos? Okay.
Photo room next.
Photo room.
Be the last door here on the right.
Yes.
Get escorted in the funniest of ways.
Right here?
Yep, you can have
Okay.
some.
So this is the photo room.
And Dr. Bauman being just
Mhm.
Okay.
Big photo room.
Okay.
Now this is not the average photo shoot. This is for hair and scalp.
Yeah.
Okay.
Wow. Check it
So-
out.
So there's Dana. Now I know some people they've tried to. Well, we did. I took a class on how to take photos for hair and scalp images, and this is like the setup.
Mm-hmm.
So yeah. When I say Dr. B is top notch, he's top notch. Look at the
Oh, yeah.
soundproof. So it's awesome.
Got the different screens for the lighting and
Yes. Uh-huh.
yeah.
So the pictures are going to be like, they're not going to be blurry. They're not going to be too dark, too light. They're going to be just right.
Yeah.
All right, all right.
You need the door closed, Dr. B?
Yeah, we're gonna close the door and we're gonna do some photos of how you look, and then we're gonna
make our plan of action.
Should I stand behind you? Is
You
what
can
that
stand
is?
wherever you like, just not in front of the,
I'll stand.
the light.
I'll stand.
That flash there. Yeah, you're doing
How about that? How about
Yeah,
that?
that's perfect.
Okay.
You're gonna have you look straight in the camera first for the first two, and then I'll tell you which way to look and turn, okay? So looking straight in, good, hold it right there. Okay. Great, excellent, and then tilt down halfway, good, nice to the floor, hold it right there. Excellent. Keep your body straight, you're gonna turn your neck this way. Turn a little bit more, perfect, just like that, excellent. Good, hold it there. Turn your neck this way, looking right here. Switch up a little bit. Just like that. Perfect. And then straight ahead to me, but tilt all the way down. Let's see the top.
You want hair parted?
No, no, we're okay, I think. Let's see. Let's see. Yeah, we can- That's really not too much place to put your hair.
Yeah.
It's okay. You could just move it.
That's good. That's good. That's good. Just like that. That's perfect. Yeah. Great. Hold it right there. And one more. Okay. Now we make our plan of action, where we're going to do the PRP. So we talked a little bit about this when we did your virtual consultation. And what we would typically do in a case like this, we know we've got some weak wispy hairs here and some weaker hairs that go throughout the front. So my suggestion is that we treat around the temple area and the hairline, and we'll work as far back as we can with our PRP and extracellular matrix today. So the markings give us the outline of where the local anesthetic is going to go.
Okay.
And that's the periphery. Everything in the inside is going to be numb once we get the outside anesthetized.
Okay.
So we don't have to put anesthesia all the way through. We just do a little bit around.
Okay.
And did the team tell you about the Pronox device, which is the nitrous oxide?
Oh, I don't know.
Oh, that's all the fun game stuff. That's going to be super fun. That's the nitrous oxide. So what you're going to do when you're back in the procedure room is it's a tube, and you can breathe through. You can take off your mask and breathe through it. When you do it, you take 3 deep breaths. It's going to make you very relaxed.
Okay.
And if you like that feeling, you can keep breathing it.
Okay,
If
Lori.
if you don't like that feeling, then you just breathe normally, and you kind of come back to regular.
Okay.
But you can use it whenever you feel something that's a little uncomfortable in terms of positioning, or if you feel the local anesthetic. We can always do it at that time.
I won't be able to do it because I'm filming.
Yes, no, not for the no, not for the crew there. Yeah, no.
It's for the patient. It's for the patient, Lori.
But that's one of the really, really nice things that we do to keep everything super comfortable as we're going through the process. And,
Well, I have a designated driver here.
well, that's good news too.
Yeah.
But the interesting thing about the nitrous is that it only lasts for a few minutes.
Oh, okay.
You can actually, our patients drive in, drive out
Okay.
on the nitrous. So what does that mean? It means in 3 minutes, you breathe normally, it's out of your system. And the nitrous is so safe, they give it to kids and pregnant women. You know, it's a very, very safe treatment that makes it all comfortable. Super.
So you see, he marked me up here on my hairline, and then right here in the.
So basically, this is the universal measurement of the area that we can treat with PRP. So we treat you around this area and all the way back to the crown. So this whole area we're going to get to today.
Perfect. Perfect.
All right, I'll take this back from you. And let's all head on back.
Okay.
Awesome.
This way. Actually, you can follow the team. They're going to take you right back in there.
Kimmy, tell me how I'm doing on the camera, because
You're doing good.
outside the camera.
Oh no, you're doing good. I can see. Don't worry. I will let you know when we cannot see.
Okay.
You're doing good. Yeah.
Okay. Good, good, good.
Can you get, since she's in there now, can you get a close up of the markings? Did you hear me, Lori?
No, what'd you say? I'm
Can
sorry.
you get, since now that they're in the room, can you get a close up of the markings before Dr. B gets in?
Okay.
Are you gonna use the nitrous machine?
Yes, I am. I'm gonna enjoy that.
So can you see some of them?
Yeah, I can see it. Yep. Thank you. Mm-hmm.
And then he did mark in her head too.
Okay. Those I can't see, but I could definitely see the hairline one.
Yeah.
How's been your experience so far?
This has been a really great experience and very interesting to see the process in which we've taken to get actually back in the chair. So I'm very excited about this whole procedure. Obviously, I want to see the results as well.
And you guys just let me know where I need to stand so I can.
I'm more following your lead.
You're following my lead?
Yeah. That's the picture right there.
No, it doesn't.
I'm following the best camera girl's lead.
What's cool is the care that's being involved in the process. Actually getting your scalp to the optimum place before the procedure, obviously with the laser, and then of course getting your scalp clean. And then the hospitality is great as well. I got my little blanket here, and I'm looking forward to this. What is it? Nitrous?
Yes. Nitrous Oxide.
Yeah, whatever the name of that, I'm gonna have it.
That's right. Keep you calm.
Right.
Okay.
And then obviously taking pictures, having a plan of action before we get started is great for the patient to see what's happening and being involved in the decision making process as well.
Mm-hmm.
And I'm gonna go ahead and readjust your chair.
Okay, all right.
And so what you're gonna be doing, you'll be able to see up there too?
No, it's just for relaxation.
Gotcha, okay.
Relaxation video on.
So we even getting music. I might be asleep. I got a little blanket. I'm warm.
I know you do look comfortable.
You got to get some music. This is good stuff.
Just gonna go ahead and pin up the hair.
Okay. Okay.
Now, Dr. B, have you done PRP on somebody with locks before?
Absolutely.
Okay.
Absolutely. So we have to just be a little bit more careful, in terms of tension and traction, but we do know all that extra weight can definitely impair the hair follicle function. So it's important if you're wearing locks to be cognizant of that for sure. It can make you more prone to hair loss in those areas. And of course, these areas in the front and temple areas they're weak to begin with.
Right. So if now we did for her in anticipation of this, she didn't do a retightening. So it's loose enough for that you can get
in and around. Yeah,
Yes.
I noticed that.
So it's not, she didn't have it done before she got the procedure. So I think that that's better to do so that you can have more access to the whole scalp.
Great idea.
Versus being limited.
Yeah, for sure. That's a great idea.
So calming.
Yes, it is. Like, what if I just fall off? You start seeing the camera go like, that means I'm sleeping.
On a scale of 1 to 10, 1 being easy, 10 being the most extreme. Okay, just let me know if I can get out of far. Okay. All right. I'm going to left side and I'm going to be on the right side.
Here we go, everybody.
Ready?
Yeah.
Yeah.
And what's that?
He's getting ready to do the anesthetic, right?
Yes, so that's an antiseptic spray, which double cleanses the area that we've already cleaned in the scalp wash zone. So that's 30-second kill of everything, you know, any kind of bacteria, any kind of bugs on the skin. Very meticulous at cleaning the area.
Important.
Doc, where are you doing the PDOs? So I can see if they see the neck up here.
All the way down, so you can just connect it from the temples to there.
Here, let me go from here then to. Yep. All right, ready? Now, here we go.
The temple area tends to be a little bit more sensitive, okay?
Okay.
Just keep that in mind.
Right, so that's the anesthesia.
You just let us know if you want to try the nitrous.
I do.
Yeah, let's get it going.
Yeah,
We're gonna get that set up for you right now. So let's do that. You take your mask down. Use the nitrous. Get this set up for you.
Go, so you're gonna take 3 big inhalants in there and breathe it right back into the tube, okay?
You got it fired up.
Yep. Okay, stop for 1 sec. And now go ahead and take a deep breath. There you go, it's working.
You feeling where I'm at here? A lot or mild?
Okay.
What's the gold? What's the?
Just a vibration device to distract the nerves.
Okay.
Oh,
And I can totally feel that, what you call the nitrate. I don't know why I can't.
The nitrous, the
Okay.
Pronox.
Okay,
they
the
call it.
Pronox. So I could definitely feel that, and the difference that it made with me, the sensitivity level of feeling the anesthesia. Although it's not really, it's not painful. You just feel something that's there. However, the hairline is a little bit more sensitive than the other areas that you're working on.
Just let the team know if you feel something. They can go slower in each different zone or faster. The vibration tool distracts the skin and blocks the nerve at the level of the spinal cord.
Okay.
Because pain and vibration can't travel along the same path. So the vibration blocks the pain. You shouldn't feel much of anything. And of course, the team's got a very tender touch on the syringe.
You sure do. I feel it.
Still good on this side?
Don't forget, Will, you can inhale if you need to. Okay.
And if anybody has questions on your feed, you know, they can certainly send in the questions. We can answer them either now or later, whatever they like.
Did you get that, guys? If you have questions, you can put them in and we can get them answered for you. Jimmy, is anybody in the Zoom?
no, but I am checking the feed to see if there's questions, and I also put that in the comments as well, that they can submit questions if they have any. So if anyone was thinking about having this procedure done, now is a great time to get some of your questions in. We have the doctor, his team. You're getting to see it live. So if you have any questions, please submit them and we'll go ahead and ask for you. As you see, Dana looks very comfortable at this facility. You know, the comfort that she's receiving. I mean, just they got the Pronos or the nitrous oxide to help keep her calm. You know, even to find out about the vibration along with, you know, pain doesn't travel together. So that's going to block the nerve. So this right here is top of the line.
You need some. Take it. Okay.
Does anyone have any questions about what they're seeing? Would like to share any information? Were you thinking about getting this done? Is this helpful to you in making a decision? If anyone is just joining us, one of our hosts, Dana Wilson, is having PRP done, which is platelet-rich plasma. So you are with her at Bauman Medical Facility in Florida. He's in Boca. So this is what you are witnessing today.
Usually takes an anesthetic to work about within 2 minutes. Okay. So the idea really is to numb the area and they kind of overlap it, so it kind of gives the area a little bit of time to get numb. Okay. I use a little different of a technique than a vibration. I like to feel where the anesthetic's going. I see it.
I was going to say, I can see it.
This way you don't
So right now they're numbing her up, you guys.
the vibration too loud.
Yeah, I'm fine actually. I mean, I'm actually pretty okay. I feel it more in the back
If
here.
you're just joining, they did withdraw 50 cc's of Dana's blood and they spun it down in the centrifuge. She then went to sit under the laser device for about 20 to 25 minutes just to stimulate some blood flow to the scalp. Then they took her to another area where they cleansed her scalp. And once they got her back to this room, they did another cleansing as well before they started to do the injections, which is the numbing medication that you're seeing right now. And the tube that you see in Dana's hand is the nitrous oxide, which is just to help keep her calm.
And if you notice that they're going along the areas that Dr. Bauman marked prior to, so that's where the numbing is taking place in that outline.
How are you doing here on the phone?
I'm fine.
If you guys have any questions, please submit them. We will go ahead and ask those questions for you. If you haven't started a watch party or shared this video, I encourage you to share it because you'll be silently helping someone else.
You know you have questions, ask them.
Yes.
Let's see, maybe they did. I gotta check mine.
So start a watch party, share this video, tell a friend.
Yeah, in the back, but in the front. No. I feel it in the back.
Now, mind you, if you call me for questions, you're gonna have to wait because I can't answer.
Please don't
I can't
call
answer
with your
phone calls
questions.
or texts or anything like that. Ask them
Yeah.
on this live.
Yeah, please do not call with your questions. Go ahead and type it in. You may even join in. If you scroll up in the feed, you will see where you can join in on the Zoom. You won't show up on the camera, of course, but you'll be able to ask your questions. So you can either come and join us in the Zoom room or ask your questions on Facebook. We will make sure that they get addressed. So ask your questions. Deborah would like to know if you're going to use laser after the PRP treatment.
Probably so. Because that is common to do. If you joined us late, they did say that in the beginning that typically you do it before and after.
Hey, Dana.
Hey.
Dana's happy.
Yes.
Yeah, I am. I am happy. But it's really not that bad.
Deborah, I will
feel a little
post it
poking in
there
the
for you.
beginning, but I can feel the numbing medication working right now.
Don't move your head. She's sticking it. That was interesting to me. I don't know if you guys can really see it that good on camera, but like Felipe said, I can see where they're putting it because it's kind of raised a little bit. So as they put it in, you see it. See a little bit how it's raised up.
Yeah. I can see it. We can definitely see it.
No.
Anything here?
No. I feel it there.
A little bit here?
Yeah.
I don't mind.
Deborah says, hi, Dana.
Hey.
I'm gonna just hit certain areas here. Just tell me if you feel.
Okay.
Anything here?
No.
Here?
No.
Here?
No.
And by doing this perimeter area like this, it's gonna, if I'm saying it right, you guys correct me, but it's takes care of that whole area, the center area too, right?
Right. It's called the ring block, and what it does is it takes from the frontal nerves and the occipital nerves, and then it kind of just, with that ring block we do, it kind of shuts down that whole middle for us. So she'd probably be numb up there for about a good 4 to 6 hours. So if there's anyone you want to fight or anything like that,
Go ahead. Go ahead. Have at it. You got about 3 hours.
Yeah, the anesthetic part is done. At any point, though, that you feel like if anything, what I like to let patients know, it's not what you can take, it's what you start to feel.
Okay.
So the experience really is your comfort is one of the main things that people feel comfortable when they do things like this. They say either it's too painful, I'll never do it again, or it was perfect and I wouldn't mind doing it again. So, so we always tell our patients, just let us know. We don't want you to feel pain.
All right.
All righty.
Did you guys hear that? It's important not to feel pain.
Yeah.
So if you're
It's
told
all about
pain
your
is,
comfort.
yeah, so if you're told pain is okay, but like I said, I'm biased. So
Okay, so I'm going to do is have you lean forward for just 1 second. I'm going to put a little compression wrap on you. This is just so that's the saline or anything just doesn't come down on your face. We'll be taking this off you in a bit.
Okay, you guys excuse me for a second. I will be right back.
Oh, you guys for 1 minute?
It's totally numb.
that's good. It's so weird how you can see it.
See
though.
it up there?
Yeah, like it's like you got little mounds, ring of mounds going around because it's slightly raised. But as they were putting it in, like you could see it travel.
Or you
And
can
they
see
go
it
to the next place and then they put it in and you see it. Yeah, it's pretty neat. Don't be afraid about her hair. It's not gonna. You're not
Oh
gonna.
no, I just got to put it.
Not gonna damage. Unless you like.
Oh, no, I just got this one of them to hold it from the wall.
I like the little device here, so you can see it.
All right, I'm just going to need somebody quick, please. I'm just waiting for this.
I'm sorry. This is the device. The vibrating device to help divert the pain.
You want me to hold this? Hold it up. just gotta snap it up and really put it on.
You want to go under?
Yeah, because I don't want it when it's trying to go through the hair to do the cornrows.
Yeah.
On the back side of it, snap it on. You know what I mean? Oh, I mean,
Here I am. How are you doing? Good?
Yeah.
Awesome.
it's all good. Good man down, man. Oh, that's this place. Look at it.
You're doing a great job, Lori.
Okay. Like this. Wait, I'm gonna show you how I'm really looking real quick.
Okay.
This is how I'm looking.
Around it that you done.
So that's why I said, let me know if the camera's off, because I'm looking too.
You looking
Wait.
around. I see. But you're doing good. You're doing good. Yeah.
Okay. So this is the Will's head, all wrapped up, just so that the saline solution doesn't run into her face, and it just goes around her whole head like that. She's still feeling good.
Yeah, let me feel some more of that.
Up to you. Just so you know, that's what's happening.
So,
How'd we do with the local anesthetic?
Good.
Pretty good, right?
Yeah.
All comfortable? So that's the part that most people are afraid of.
Oh, really?
Yeah.
Oh, okay.
And now that the local anesthetic is in, everything is completely normal. Obviously, we're going to test it
Right.
and make sure that you're comfortable, but everything up on the top should be 100% asleep, so
Okay.
to speak. All right.
okay.
This is so exciting. So we have the relaxing music, and then we also have this nice visual too, which is added
Oh, yeah.
luxury.
All the creature comforts.
Mhm.
Yes. Let's see. We're going to test all the areas where we're going to be doing our treatment today. So just let me know if you feel something uncomfortable at any time. Right now, we can always add a little bit more local anesthetic to it, okay? Pretty comfortable here, no pinching, right? How about here? Pretty good? Great. Let's take a look back here. How about here? Great. Excellent. Awesome. So what that means is that you're totally numb. All right. So this part of the procedure is the PRP going in. So we're going to work all the way through the temple area, all the way across the hairline. And today we've got 1.7 million platelets per microliter.
Wow, that's
which
good.
is a 6 times concentrate of your blood platelet concentration.
Okay.
We're also here live on the Bauman medical page as well. I know that you guys are live on your page.
So Dr. Bauman,
Yep.
when you put the plasma in there, what does the plasma do now once it's inside?
Yeah, so that's a great question. So what we did is, let's talk first about what the process is. So we took that small blood sample, right? And the blood sample contains everything: red blood cells, white blood cells, platelets, plasma, which is the liquid part of it. You know, it contains the liquid and the formed components. So the centrifuge, the spinning of it, separates out those formed components by weight. And the idea is to separate the platelets from the rest, because the platelets contain very powerful growth factors. The growth factors are these chemical messages, right? Messengers. They're chemicals that tell the follicles and many other parts of the body, actually, for wound healing and things like that, to trigger tissue regeneration and repair. And that's why platelets are so valuable and important in regenerative medicine. But the key is using enough platelets. So it's kind of like you want to get enough chocolate chips in your chocolate chip cookies, right? You don't want just one chocolate chip, you want a bunch of them. And so the way that we separated the platelets today is to get to that special dose that I mentioned before, 1.7 million platelets. So we want to get over 1.5 million platelets per microliter. So that's billions and billions of platelets that are in this treatment for you today. And that's what I'm just finishing off now, putting into the scalp.
Let's see. That tube was full.
That was that whole syringe went in. That was about 7.5 cc. So that was a large volume of high density platelets. This is the activation, one of the activation steps. So this syringe contains some platelet poor plasma as well as some calcium. And calcium tells the platelets to release their growth factors. And it also contains some B vitamins.
You still don't feel anything, right?
I don't feel much at all. I mean, I feel
You're going to feel the
something
tapping,
small.
right? But you
Right.
don't feel anything uncomfortable in any way, shape, or form. Felipe, can you get that door for us? Yes. Yes. So there we go. All of our platelets and plasma are in the scalp right now. The next step we're going to do, since we're doing also the PDO grow procedure, is we're going to place the PDO threads into position into the scalp. So that's the very next step.
So tell us about that.
So PDO is short for polydioxanone. And polydioxanone is something that's been around for quite some time, literally like, I would say probably at least 4 decades or so, as a slow absorbing suture material in surgery. And this material can be placed into the skin. We did it many times in my surgical residency and my surgical training. If we wanted to stitch things together in the body and make that stitch last a long, long time, like 6 months. So these threads stay in the body for 6 months, even longer in some cases.
Now, what?
So the threads, what we're placing into position right now. So what you're seeing are these little pink handles that are left on the end of the needle. And the needle is what we're using to insert the threads into the skin.
Can you see that, Kenny?
Yeah.
We're doing good. And so we place these threads in a particular pattern that we've developed over time. They don't overlap, but they're in kind of a radial pattern. As you can see, they're about 0.5 centimeter apart from each other in the skin. Put them in a pattern where it's going to stimulate the follicles. So we know this. These threads have been used in many, many different ways in medicine over time. For example, in cosmetic procedures to lift skin, to stimulate healthier skin, to reduce wrinkles, all these good things. But in this particular case, we're using them to first found out about this, when I was first informed about it, I was a bit skeptical. I didn't know exactly to do this. We did some research and found that this is a couple of years ago now, that sure enough, back in the Far East, they were doing some testing and some trials with PDO in the scalp, and they were showing some really, really good hair growth results. And so I got excited about it. This is a couple of years back. And we started to use it. We tested it as a standalone treatment in our patients to see if it would grow hair in a pilot study. It certainly did. We presented that information at the South Beach Symposium a number of years ago. And we've been using this in conjunction with PRP in some patients to stimulate hair growth. So it does take a little bit extra time, as you can see.
Deborah, yes, this is in addition to the PRP. Deborah's question is this treatment in addition to the PRP?
Yes.
Yes, we're using it in combination with the PRP.
Yeah.
The original study was done with just plain PDO, and then we started doing it in combination to get a little bit of a better result. Almost got all of our threads in place.
Deborah's asking
With all
for the
the
name of
threads in place, my team will take a picture of it.
What did you want to know?
the name. She wants to know the name of this with the
Of this
thread.
procedure?
Yeah,
Yes.
the threads, I guess.
Well,
Yeah.
they're polydioxanone, PDO.
PDO.
PDO, polydioxanone, and this procedure is called PDO Grow, PDO-GRO.
PDO grow.
And that's our protocol for this treatment.
Diana wants to know how often can someone do this treatment?
So is she asking about the PDO by itself or?
The entire treatment, the whole PRP process.
I'm going to take a picture of it now for the medical record.
Oh, that's a nice picture.
Okay. And then these guides come right out of the skin and they leave the threads behind. So.
Lori, I don't think Dr. B heard that.
I'm sorry, what was the
Okay.
question?
So how often
Do we need to do this?
should this whole procedure be done?
Yeah, so we measure it. It should last about a year, sometimes even more, because the threads are in place under the skin, dissolving for 6 months to 12 months. So you get a very, very long boost of hair growth from this treatment. We have some patients that last up to 2 years, but the average, I would say, is about a year. And we found that the PDO with the PRP has a longer and stronger effect. Now, one of the newer steps, we're getting closer to the final steps here of the process, is the use of this stem cell growth factor cocktail. This is a liquid that we use on the skin. This is from a company called Anti-Age, and this is made in a laboratory by taking bone marrow derived stem cells and putting them in a specific type of environment so that they release very, very important growth factors. Remember, the growth factors are the signals. So that's being placed topically on the scalp, and we're going to use the microneedling tool to microneedle that material right into the scalp. So there's no cellular material there. Those are just growth factors. And here we have a super fun and sophisticated microneedling device. This is a German tool, German device. And the best thing about this device, especially in your type of hair, is that we can use it in between these locks very carefully. microneedle the skin, which is the final step of the process, creating a little bit of micro trauma. You're not going to feel it, but it does turn the skin a little bit pink for a couple of hours. And you can hear how smoothly this goes right over all the areas that have hair. This is a great device. This device is called Exceed.
Exceed.
Exceed, yeah, Exceed.
Lori, straighten up. Straighten up, Lori.
Okay, sorry.
Camera directions from How are you feeling so far?
I feel fine.
Great, great. We're almost done with the whole process. All right. Make sure we've got everything stimulated all the way around. This is not like a resurfacing treatment, so you're not going to see so much aggressive treatment there.
That's what he just used.
See, the scalp is a little bit pink. Now this is still quite right? We want to make sure that all the PRP is spread out, that there's no lumps or bumps. And then the team is going to get this area all cleaned up, and they'll give you a full set of instructions for tonight. Super simple, not much to do. We do include a stem cell nutraceutical with your procedure, so we're going to give you that. It's the first and only nutritional supplement related to stem cell support that has clinically published, peer-reviewed research behind it. That's called StemKine, or StemVoc is another name for it. And that goes with every PRP patient home. You're going to take two of those pills twice a day for about a week or so. And that nourishes the bone marrow and then causes the bone marrow to release stem cells into the circulation. And hopefully they hear the call, the message that we're sending right up here. So everything is all said and done. We thank you to everybody who tuned in today.
Awesome.
And again, if you have any questions about PRP, PDO, we're here for you at Bauman Medical Hair Transplant Hair Loss Treatment Center. And look forward to seeing you all soon.
All right.
Thank you.
And we'll post the information too for Dr. Bauman's medical center. So you'll have that information following this video. Thank you everyone for watching. Thanks, Dana. Thanks, Dr. B and staff.
Thank you, guys. Let us know if you have any questions.
Ready? 1, 2.
I stopped the Facebook, but I'm still here.
Okay. Okay. So
Deborah said, thanks for allowing us to see. She just posted that.
So he's just cleaning off.
Okay. Yeah, this part is still recording for the Zoom.
Okay.
For when we repost. Yeah.
Okay.
You can do have some areas that may shrink a little bit of water, and that's no worries. It's
Right.
just
Yeah, the blood wasn't bad either. It's just the blood from the prick.
Yeah.
Oh, wait till you see the picture with the PDO.
Really?
Yeah, that's nice.
Yeah.
That was nice.
Yeah. Yeah. And neat too, because I'm getting a nice pattern going.
Yeah.
hit forward for a moment. I'm going to bring you back to the laser in a minute. What I'm going to do is I'll go over again what Dr. Bauman said. Give you a little goodie bag to go home with.
That was quick.
Yeah.
Dr. Reed he moves fast. But I guess once you numb that area,
You can
I
do
mean,
that.
you can do that.
Yeah.
You know how many people we hear say that they don't get numb? That's why I'm like, are you crazy?
Right. And they can't even take it. Like, got to stop midway.
Yeah, no. But that's why they have them coming back so often too.
Right. Because they couldn't finish.
Yeah.
Yeah.
You good, D. Will?
Let me tell you, Dana looks relaxed. She don't even look like she had a procedure done. She look like she chilling. All right, so you're gonna get what, like another 25 minutes of laser? Is that what's gonna
Yeah,
happen?
yeah,
Lori?
yeah. She's gonna go up under
Okay.
the laser.
All right. You guys did good.
Yeah, it was great.
Yeah. Mhm.
Great.
Yeah, we had I think we had like at least up to 8 followers at one time
Oh, really?
on the
Okay.
Facebook. Hmm.
That was good. That was good.
Yeah, I mean for middle of the day, yeah, 'cause, you know, people are working, you know. That's good. So, mhm. So after the laser, that's it. She'll just get her medical pack and that she's gonna take home and
Yeah. Yeah.
okay. Well
Well,
then,
that's cool.
yes, that was good.
That
This
was
was
good.
great.
What
For
time is it? How
this
long
is a
did that
good
take?
season finale, don't you think?
I know it. It is. How long did that take?
It's 1:46. It's 1:45 now.
Oh, okay.
You guys got on a little after 12. It wasn't exactly 12, so under 2 hours.
Okay. Yeah. And that was, us doing, um, uh, that's with them doing extra stuff. So us recording was a little different.
Yeah.
Otherwise, it would just, bloop, 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 pretty much.
Yep.
But he had other patients today too, so
Okay.
that he's seeing. Yeah. Ooh, that was good.
It was. It was. It's a nice season finale.
That was awesome. Thank you.
Yay. All right, so we got some good video.
Yeah, and then Michael is going to he's going to share what they did with us too.
Okay, yeah, I noticed we were tagged
Okay, yeah.
their Facebook. Yeah, we were tagged. So yeah.
Yeah, so they're gonna do that's gonna be good.
Mhm. Yeah. Definitely. Definitely. I will repost Dr. B's stuff with his
Okay.
contact info. So I'll do that. I will put that up in Facebook like
Yeah.
now.
Okay.
I'll do that. So I'll let you go now, and y'all
All right.
enjoy the rest of your day. What time is your flight again leaving out tonight?
9:00.
Yeah, I got a long time.
I know, right? Oh my gosh.
Yeah, and go check out the town.
I guess. Wait, I need to call Marlene.
Okay, y'all can go have those drinks. She's probably out hanging.
Girl.
I got a message from Martha. So she was saying something about she didn't hear back from us in regards to Transplants. So I'm like, we're waiting on the application. So
Oh yeah.
yeah, we left. So she just sent that.
Oh, okay. She sent the application?
No, she said that she was they're waiting on a response from us, but I'm like, we never got the application.
Yeah, we waiting on y'all.
Yeah.
We ready.
We ready. Yes, I'm gonna do that now, and I'll check back in a little bit. So I'm handle
Okay, cool.
All right, see ya.
Bye.
Bye.